Pregnancy induced hypertension. We'll take a case history of this today as it is the most important amongst all. There is 110% chances of getting this case as your practical case. So do not miss this case. Starting with the case, general identification details you have to ask to patient, followed by the parity index, followed by the presenting complaints, that is chief complaints, and followed by history of presenting complaints. So she is a G2A1 female with 8 months of amenorrhea, and she presented here with complaints of generalized edema since 10 days. Now we have to describe that patient is gravida 2 para 0, present with generalized edema since 10 days, which is insidious in onset, initially noticed in the lower limb, which have gradually progressed to involve the upper limb and face also, and it is present throughout the day, no diurnal variation. Throughout the day it is same, it is not changing, not relieved by overnight rest nor by the limb elevation in the morning. No history of headache, blurring of vision, or syncopal attack. No history of reduced urine output. No history of chest pain, palpitation, breathlessness on exertion, or history suggestive of cardiac failure. No history of epigastric pain, nausea, vomiting. No history of diabetes or hypertension. No history of jaundice, ascites before 20 weeks of gestation. So, overall, in the negative history here, you have to elaborate the points which are pointing towards the imminent eclampsia. Now, for the present pregnancy, you will take trimester wise history. First trimester, First trimester history, morning sickness for 2 months was present, increased frequency of micturition, no history of fatigability, no history of discharge or bleeding PV, or no history of any drug intake, radiation exposure, or no history of pica. Then second trimester history, quickening at 5th month, no history of headache, blurred vision, or sudden increase in the weight, booked or immunized case, 3 ANC visits, 2 TT injections, and scan done at 20th week, which is a anomaly scan. So for this patient, her first scan was at 20th week. In the third trimester, fetal movements was present. No history of bleeding or discharge PB. No history of pain abdomen. Generalized edema is present. For OBS history, she is married for 2 years, G2A1 with LMP 3rd of November 2006. Now the previous pregnancy, as previous one is last is abortion, so you have to mention that and describe that. The last abortion 1 year back, that was a painless spontaneous abortion at 6 months, and following bleeding PV, patient had gone for 4 ANC visits to scan in that pregnancy. It was booked and immunized. No history of excessive vomiting, rule out HMOL. No history of hypertension during pregnancy. In now menstrual history, her age of menarche is 16 years. Her past cycles were regular, 30 days cycle, no pain or no passage of clots, no history of any contraceptive use. In the family history, no history of diabetes, hypertension, asthma, twinning in family, no history of PIH in mother or sister. Past history, medical, no history suggestive of diabetes, hypertension, no history of TB, epilepsy, asthma. Past surgical history, no history of no history of any previous surgical procedures. And one more thing, that blood transfusion history also you have to mention, because for this case this is important. Now the personal history, she took mixed diet, have a good appetite, and sound sleep, regular bowel and bladder habits. On general physical examination, pregnant lady with a moderately built and nourished, conscious, alert, cooperative, well oriented to time, place and person. Her pulse rate is 86 per minute, regular, good volume. BP is 146 by 92 mm of Hg. With a respiratory rates of 18 per minute regular, she is afebrile on touch, pallor is present, and edema is present, which is pitting in nature. Otherwise, icterus, cyanosis, clubbing, and lymphadenopathy are absent. On examination, thyroid, breast, spine, and gait normal. Height is 160 centimeter, weight 70 kg. She falls on her BMI is 27.3. So do comment in which BMI, which category she is falling. Systemic examination, CVS S1, S2 heard, no murmur. On respiratory examination, normal vesicular breath sounds heard, no additional sounds heard. On CNS examination, knee jerk is present, sensory, motor, and cranial nerves normal. PA, normal bowel sounds heard. On obstetric examination, inspection, abdomen is uniformly distended, flanks not full, umbilicus everted, striae gravidarum albicans and linea nigra present, no scars over abdomen, no dilated veins, hernial orifice normal. Palpation, patient examined in a supine position with legs semi-flexed. Fundal height corresponds to 32-week gestation. Symphysiofundal height is 28 cm. Abdominal circumference 85 cm. On a fundal grip, we felt smooth, broad, irregular structure suggestive of breech. And lateral grip, right knob-like structure suggestive of limbers. Left side uniform curve resistance suggestive of spine. On the first pelvic grip, smooth, round, hard ballotable mass not engaged, suggestive of head felt at the lower pole. On auscultation, fetal heart sound heard along the left spino-umbilical line midpoint, and heart rate is 146 per minute regular. So my diagnosis is 20-year-old G2A1 with 32 weeks of gestation, single live fetus with cephalic presentation, with head not engaged, not in labor, with mild preeclampsia complicating her pregnancy. Thank you.